Hey everyone, welcome to Unfiltered Beauty. We are here with Dr. John, my boss. Welcome. This is your first time as a guest on Unfiltered Beauty.
It is. I kicked off Stephanie, unfortunately, and you get me.
Yeah.
I don't know. I don't know that that's an upgrade.
You're my second favorite coworker. I mean, first because you pay me, so
That's the right answer.
yeah. So welcome.
Yeah.
I'm glad to have you here. Let's talk about some fun stuff.
So tell me how you got into aesthetics.
Well, I have been a nurse for 12 years. After 2020, I decided not to go back to Bedside, and we moved back from Hawaii at that time. So I was doing transfer center kind of thing. And I went back to my dental office that I had prior. I was getting my crown fixed. And this guy that I knew from 10 years prior walked by and he's like, "Hey, how would you like to work for me?" And that's how I got into aesthetics.
And that guy is me.
Yes.
Right.
So I was not looking to get into aesthetics. It kind of just fell in my lap, and I'm so glad it did because it's really fun. I love that I learn new things every day. I can use my nursing skills still, but not be at the bedside breaking my back and worrying about keeping someone alive. So a lot less stress. It's just a lot more fun. I get to work with some fun people, go on trips.
Mhm.
So it's been good.
You said a lot less stress.
Yeah.
So let's do bedside stress on a scale from 0 to 10, 0 being no stress and 10 being exceptional stress. What's bedside nursing like?
Definitely, I would say so towards the end of my bedside career, I started rotating. So I started doing day shift and night shift. I was always night shift before. And I always thought that just nursing across the board would be probably a 10, especially on my floor, because we had a lot of sick patients. But then going into day shift, it could definitely get worse. So I would say 10 out of 10 across the board. It's just so stressful. But day shift, definitely takes the cake.
And then you made the shift to private practice, and you made the shift to aesthetics. What's your stress level now?
Oh gosh. I would say for work, it would be like maybe a 2. I don't know. Very, very minimal stress.
Mhm.
The only stress I have in my life is trying to juggle everything, but that's it. That's it. It's fun. Yeah.
Yeah. And so do you dread coming to work now?
No, I actually come to work so much. I work a lot, like almost every day. I'm probably popping into the office on the weekends, even just for like one patient. I feel like I'm always there.
Because it's fun.
Yeah, it's fun.
Yeah. And
I don't mind it at all.
And the thing that a lot of people don't realize when you're working in aesthetics is that you go from hell to, oh, this is fun. Like
Yeah.
work can be fun.
Yeah.
Like you don't dread going to work. Like,
Oh, no.
Like when I worked at the hospital, it was like, because I would do like 3 on, 1 off, 3 on, and then I'd get a week off. And that week off I just loved because I didn't have to think about work or anything. And then at the end of that week, like 2 days before, I'm like, ooh, 2 days I got to go back to work. One day I got to go back to work. Remember that?
And in Hawaii, we had a different schedule where you had to work every other weekend. So you never got to like have that big break if you wanted to.
Mm.
You would just do your 2 weekends, your Saturday, Sunday, and then you would work like a random day and then all over again. It was a lot. It was a lot. This
Yeah.
is good.
Yeah, it's much better. And here's the other thing that nurses don't realize. When you start off at bedside nursing and you do these 12-hour shifts, you love them in that you only have to do 3 days a week.
Mm-hmm.
And you're like, oh, why would anybody want to work 5 8s? Right?
Right.
Which is better?
Definitely aesthetics working during the day, clinic hours, and especially for me because you were so nice that I only work 3 days a week from 9 to 3, and
Oh, it's
so
horrible.
I have the worst boss ever. So I get to take my kids to the bus and I get to pick them up after from the bus stop. And so I don't feel like I'm missing out on anything. Whereas when I worked night shift 12 hours, I was recovering for at least 2 days after my shift ended. I was always tired. I could sleep all day. Now my body just automatically wants to wake up at 7 a.m. And I think that's great. I feel more healthy
Yeah,
and my sleep's better, not the best, because I don't think 10 years of bedside night shift is,
messes you up.
oh yeah,
I'm still
for
messed
a
up from
long
it.
time.
I did 5 years, and my sleep has never been the same. I used to sleep like a rock. It was great, and now it's interrupted, and I still struggle a little bit with sleep
Yeah.
sometimes,
Yeah.
which is too bad. But um, I'll just tell you, for all the nurses that are working 12 hours out there, those 12-hour shifts, I promise you, 4 or 5 8-hour shifts a week is superior because you're home when the kids are home.
Mhm.
And you can have an evening with your family and you can have dinner and you can go to games and you don't miss anything.
Yeah.
You really don't.
I really love being home for dinner every night
Oh, it's a huge deal.
and tucking them into bed at night every night. That's like kind of the thing that my kids and I do is we snuggle before
Mm.
bed. And I just remember they were always like, "Oh, you're going to work? Okay." They were just bummed that I was leaving, and I felt bad leaving them too before bed, but now it's nice. I just feel like I'm home more
You are
with them, so
100%. Especially for the ladies, because the ladies have a lot of mom guilt. Like dads don't typically get dad guilt for working lots of extra hours and stuff, but all the female nurses I worked with get such mom guilt for missing
mhm.
out on kids' things and whatnot. So it's nice that you get to do that again. So,
Yes.
well, tell us like the training process. Like, how did you get trained up in aesthetics?
So you would help me learn hands-on during the work hours, which was great. And it kind of built up. So I kind of watched you, I assisted you, and then you started having me do more and more. I took your courses and they were really helpful and I just kind of jumped in. And I feel like it's something that you have to definitely practice on trying to unlearn your habits from bedside and the way that you use a syringe and the way that you inject and the way that you handle a needle. And you just have to relearn all of those techniques and learn what works for you. And going to conferences, watching other people's techniques, trying to find your own technique that works best for you. So it's definitely been a journey and it's still I'm still learning, and that's what is so fun about it. I'm
You
never
never
bored.
end. It never
Yeah,
ends. I learn stuff every time. I mean, you and I went to a conference, what,
May.
May? We learned all sorts of stuff,
It was amazing.
right?
I know, it just makes me wanna go and do
You're
more.
doing another one coming up, aren't you? Or are you thinking about
Maybe.
it like in
I am.
September?
Yeah, I'm thinking of it. I definitely am gonna do another one by the end of the year just because I just have that itch again, and
Mm.
I wanna learn more, and I feel like there's so many new things coming out and so many new techniques and so many things we're learning as the years progress with aesthetics. And so I just want to be on the learning side of it.
Yeah, I've been in aesthetics now for almost 8 years. And you've been with us what, 3 years?
Mm-hmm.
Almost four.
Mm-hmm.
Um, but I've been in this in 8 years, and you never stop learning.
Mm-mm.
Like, and even, I mean, I've been doing talks, I don't know, 5, 10 times a day for 8 years. And we went to that last conference. We learned new techniques, right? We learned new techniques. And I'm like, oh, that's kind of interesting. Like, oh, maybe I'll adopt that. And I tried some, and I'm like, I don't like this, because we did the concentrated talks. Remember how we
Oh, yeah.
yeah, they're
Yeah.
like, oh, if you concentrate it, it works better. And so I did it on a few patients. Like, I don't like doing it this way. I don't like doing it this way.
It can get complicated. And I feel like with complication and the more you have to think about something, I feel like the more issues can arise. So just having a good, foolproof way to do things across the board is kind of nice.
Yeah, it's kind of nice. So now you're a nurse injector. For the nurses that are listening to this, what does that mean? A nurse injector? Like what things can you do? What things can't you do?
So I do tox fillers. I do some facial treatments like microneedling, BBL. Um, I feel like, there's so much that you can do. I do Kybella too, and things like that. I don't do the really in-depth like CO2 laser. You do that. Liposuction, I don't do, but I assist you with
Hmm.
it. Those bigger procedures, I don't do, but I kind of just love doing what I do
Hmm.
and doing those injections because I feel like I can be proficient in them. I do them enough. The other things I probably wouldn't do
Yeah.
very much.
But we're trying to get her a nurse practitioner so she could do some more of that stuff.
Yes.
Because Dr. John is like, okay, let's let somebody else do some of this stuff, right?
Yeah. Yeah.
I'll tell you another thing that you do really well is I was walking up to the front desk yesterday and I had just consulted a new patient. And I don't know if you know this, but when, I always recommend skincare products, but I always give the wrong ones. So recommend the wrong ones. So I'm like, when you go to the front desk, just talk to the ladies. And you and Stephanie were up there, and I had left and I came back and you guys were sampling the products and she was putting it in. I don't know. Did she buy anything?
She is sampling and she's going to buy I think she's going to definitely buy moisturizer, which is great.
Hmm.
And just talking to her, I feel like a lot of people don't realize what they need, or they don't even think that they need anything. They have no idea. And then once I talk to them about it, they're like, oh, that makes sense. I do need that. That would help my skin problems that I came in for the consult for. So, and it's nice that we have some samples that you can try so that you can determine, if you like the consistency, the smell of it, the feel of it, that kind of thing.
Yeah. And there's a new thing you've been doing in the last 6 months or so in aesthetics, and you haven't mentioned it, which is
Training?
training.
Training.
Yeah.
Yeah, training talks mostly. We'll see a lot of your nurses will be doing filler soon, I think, but it's very good to start off with one kind of practice, new treatment, which would be talks, just to get proficient in it. At least that's how I did it, and I feel like it worked really well
And that's
for
how I
me.
recommend it. Like Tox in aesthetics is 70% of the business, would you say?
Oh, yeah. Yeah,
Like patients
definitely.
coming in through the door, 70% of what they want is Tox, right?
Right.
And and then eventually they'll do a little bit of filler and they'll do a little skin treatments and stuff like that. But everybody thinks that filler is sexy and they want to learn filler and they want to do lips and they want to do all this kind of stuff. And that's great, but it's just you do lips, they're done
Mhm.
for a year and a half, and you're not going to see them again. But Tox, they're back in 3 months.
Yes.
And so it's much easier to build a practice on Tox than it is filler.
Yeah, and filler's more of an art. So I
Hmm.
feel like once you get talks down, then you can kind of focus on your skill and learning all of the filler stuff, which is completely different than talks. So, yeah.
Yeah. Well, let's talk about that. Learning your art. What's the best way to learn your art?
I think, watching videos on other people's technique and understanding anatomy and understanding the danger zones and what makes them dangerous. And I think that's pretty much it. And then once you get a patient, you kind of take it slow and you take your time and build up. And I think that's the best way to go about filler.
Practice,
Oh yeah.
practice, practice, practice.
Yes.
You never stop. You're always
No.
learning.
Mhm.
Mm.
There's always a different way to do it between needle, cannula, and different
Techniques.
techniques, different areas, help build this or that. And you just never know. It's crazy. The last conference we went to, they were putting filler in like the hairline. I was like,
I
what?
know.
It's crazy.
Hmm.
Crazy. But yeah.
Yeah, that's cool. What's one of your favorite filler products?
Radiesse.
Radiesse.
Yeah.
Why Radiesse?
I love that it's kind of
Well,
two
let's talk about
birds.
what Radiesse
Okay.
is.
Okay. So Radiesse is a biostimulator and it helps. It's a filler, but you can also dilute it down to help stimulate collagen and elastin in your skin. And it can have long-term effects. So meaning even if it's not filling anymore, it can still help your body produce collagen and elastin 18 months to years later. So I really love it. I love it in conjunction with other collagen stimulating treatments like microneedling. I've done it a few times where you do microneedling and then you do Radiesse right after, and you just get the best skin texture, a glowing, glowing skin. It's great.
Yeah. So for those of you that know what Radiesse is, she alluded to it as a biostimulator. It's little tiny calcium particles that are suspended, and they're very safe. They're these little round particles, and when you put them in the dermis, a cell type called a fibroblast gets activated, and the fibroblasts coat these particles, and they're like, "Hey, this isn't supposed to be here," but in a good way, and it will remodel the collagen you have. And because those fibroblasts get activated, fibroblasts make collagen and elastin and all that fun stuff. And then they'll remodel your collagen matrix. They'll build and add to the collagen matrix, and those particles stay for some time, for months to years. And so you just get this constant stimulation. So it's like you're getting microneedling every day.
Mhm.
And collagen at the age of 25 for most women, you start burning it faster than you can make it. And it's a slow go all the way to death, which is why as we age, we look older and older and older. But if you can get a little bit of collagen stimulation in there, you can slow down that process and look. My favorite is, I mean, our typical patient that starts worrying about like collagen and skin breakdowns, late 30s, would you
Yeah.
say, is when they really start to notice it. And when you get our patients in the late 30s on these biostimulators, and by the way, when you dilute a biostimulator down, it's like one of the safest things you can do. Like you can put that
Mhm.
in an artery or vein, it's not going to do anything. So it's super safe treatment. But so these, women will come in and they're in 38, and then they'll start doing this. And then as the years go by, their peers age and they don't, and it's a win. And I don't know if I've ever told this story on this podcast before, but my wife, when I started getting aesthetics, she was in her late 30s. I won't say her exact age because she'd probably be upset. And so we started doing all this stuff. Started doing microneedling. She comes in all the time, right? She's
Yes.
always getting something done. And we have her before photos of what she looked like at in her late 30s. And fast forward 8 years, we are we are now at a stage where her friends are like, "Why do you look so good? Why do I look so bad? And why do you look so good?" And it's not that she looks, I mean, if you look at her photos, she looks better now than she did and she's 8 years older. And that's a win.
For sure.
I guess I just gave her age. Might have to cut that one out. Uh, Sam's laughing
I was
because she was
like
doing the math.
counting in my
Yeah.
head.
Anyways, but anyway, she looks way better now because she just does all this stuff, and it doesn't have to take a lot of money or a lot of effort. Just it's like working out. You got to do that. You got to do it.
What are you going to do? Do you want to do something just to keep up with your collagen loss? Do you want to be more aggressive? Do you want to turn back the clock? Because the longer you wait, the harder it is to fix things. And if you just keep up with something, some sort of treatment, nice skincare, tox, filler, those little things here and there, you're not going to need a big fix later on. It's just maintaining and keeping up with your collagen loss.
100%, 100%. And it really doesn't take much. I mean, I think our average patient that just does a little bit of everything might spend, I don't know, $1,500 a year. Maybe that's tox, maybe a little bit of filler, maybe a little bit of skincare, maybe 2 grand a year to kind of keep on top of, which sounds like a lot of money, but when you're 60, you'd spend all that money all day long to look 50,
Oh, yeah.
right?
Even more money than that.
hmm
'Cause you have to do
Facelifts and
surgery at that
fat
point.
transfers and chin grafts and all sorts of all sorts of stuff, right?
The one thing I love about Radiesse is it's not very much more expensive than other types of fillers if you want like cheek filler or chin filler, jawline filler, but you're getting that extra benefit of collagen and elastin stimulation. So that's kind of the selling point for it. You spend a little bit more, but you get long-term benefits for it. And you're getting that filling and bone structure and things like that. So,
Yeah, it mimics bone really well. Like I
mhm.
love putting it on cheekbones, jawline bones, like deep is great. And if I go superficial, I'll dilute it down to get
Yes.
that collagen, But Radiesse is fantastic. There's another product out there called Sculptra, which is also a biostimulator. It's a little bit different. It is an absorbable suture that's ground into a powder, and that's injected as well. And you can get some great results with that. But it's more of a it's stimulating effect. If you look at them under a microscope, Radiesse has little round particles, and Sculptra has very jiggity jaggedy particles, right? I mean, you've seen the slides of it.
More
Yeah,
inflammation
and so
effect.
it gets through more of an inflammatory response to get your collagen, and it will build less elastin and more collagen. So if you need more structure, maybe Sculpture might be the better one for you. But if you just want a general overall improvement, with the elasticity of your skin. So if like, let's say you have a bunch of little fine lines in here, that's elasticity. You need more elasticity in there. Then we'll put you into Radiesse, and Sculpture is much more expensive than Radiesse too. So I don't know, 95% of what we do is Radiesse, would you
Oh
say?
yeah, definitely.
Yeah.
I like just because I can take one syringe and I can do so much with it. I can dilute some of it down. I can hyper dilute some of it down and I can use some of it as straight filler. And so I feel like my patient's getting more bang for their buck because they can fix kind of a few problems with one or two syringes, but in different ways.
Yeah. So it's a great product, and we love using it, and we call them liquid facelifts because it just kind of gives you this global volumization.
Mhm.
Um, I've never,
Patients love
yeah,
it.
I've never had anybody like say, "Oh, I hate this."
Right.
Have you?
No. Mm-mm.
Yeah, it's
They
great.
always love it. They're
Yeah.
like, "My skin's glowing. I look so
Well, and the other
young."
thing that's nice about Radius is there's no downtime.
Right.
Like some of the skin treatments, like if I'm doing a laser treatment on you, you're 2 weeks and looking like hamburger meat,
Yeah.
right? And so that's not with Radiesse. Radiesse, we just punch a couple little needle holes, put a cannula under the skin, and just flood the whole area, and you'll get a very similar, collagen response, and you can go about your day. Next day, you're working out in the gym, go on the boat, go get on the lake, right?
Yep. And I think my patients appreciate the aftercare too of Radiesse versus Sculptra.
Mm,
I kind of when patients are like, "Well, what's the difference? What do I have to do differently?" And I tell them, "Well, with Radiesse, you have to massage 3 minutes 3 times a day for 3 days. Sculptra 5 minutes 5 times a day for 5 days."
yeah.
Just a little bit
And why do you
more.
have to do that?
You just have to it can cause granulation, and so because of that inflammatory response and the shape of the molecule, so you have to really integrate it into your tissue so that those bumps and lumps don't occur.
Yeah. So if a little chunk of Sculptra gets in a certain spot, the body's going to encapsulate that, and you'll have this bump that lasts for years. And
Yeah.
so you don't want that.
No.
You don't want that. So, so we talked a little bit about getting into nurse aesthetics. We kind of went off topic there a little bit with Radiesse, but what are some limitations? I mean, you talked about some of the procedures, but what's one thing you need as a nurse to inject in state?
You need a medical director
Yep.
and, which I'm lucky enough is my boss.
Hmm.
So, yeah, I mean, if and you wanna have a medical director that understands aesthetics. There's doctors who can be a medical director and they have no idea what you're doing. So if you come upon a problem and you need somebody to help you, which should be your medical director, they oftentimes don't know what to do either and can't give you the advice you need. So it's really important to find someone, not your uncle who's a dentist, not, your eye doctor or whoever. You want someone who knows aesthetics and can give you good advice when you come upon problems because that will happen. It will happen. Even the best injectors have some issues that they come across. So, and that's how we learn too.
Yep, 100%. So the medical director is prescribing these medications. These are all prescription meds. Tox, filler, Radiesse, Kybella, all prescription medications, and nurses can't prescribe, unfortunately. Someday it might change. I don't
Yeah.
think so, but so medical director, yep, that's important too. So you got the whole best bang, so which is great.
Yes. I lucked out.
So, but yeah, so if you're interested in getting into aesthetics and you're a nurse, again, our sponsor is 5 Square, but they'll find a medical director for you. They'll help you get you where you want to be with all the proper training and legal support and all that kind of stuff. So another plug-in for our sponsors there. So anyways, and then maybe Sam, who works for 5 Square, will come and train you, right?
Yeah.
Which is super fun. Okay, well, that's great. So thanks, Sam, for coming today. A real quick podcast. Appreciate it. And without further ado, we'll let you guys all go. Thanks for coming. Thanks for watching.